Hello, I am Dr. Jagruti Parikh, practicing endocrinologist concentrating on diabetes and thyroid in Mulund and Thane at OM Diabetes Research Centers. Today I am going to talk on diabetes in childhood. There are two types of diabetes in childhood. One is type 1 and one is type 2. Previously we thought type 1 is the only or the most commonest variety of diabetes in childhood, where the presentation is normally excessive hunger, excessive thirst, excessive urination, children going to washroom very frequently in the school, that's the commonest complaint, bedwetting, ants around child's sleeping area or ants around child's playing area, falling frequently sick or requiring medical attention very frequently, but are the commonest presentation of type 1 diabetes in children. The other variety, that is what we see now very often last 10 to 15 years, is the type 2 variety, which was not seen 15 years back. Why sudden change? The change is because of change in lifestyle in last 10 to 15 years. When I say change in lifestyle, that means there is a change in eating habits. Children are eating more junk food, fast food, ready to make, ready to serve, food with lot of preservative and food with lot of processing. In addition to that, there is lack of daily routine exercise, increase in school area, sitting area, timing, or increase in the tuition timings, lack of external sports activity, more concentration on TV, television, computer games, mobile games, all that reducing the regular activity or exercise in day-to-day life of children, resulting into insulin resistance, obesity, resulting into type 2 diabetes, or the term which we say diabesity. Many times in type 2 diabetes, presentation is not similar to type 1 diabetes. That means very often it is very difficult for parents or doctors to suspect them, because most of the time in the children, the investigations done are CBC, urine routine, or some specific infection related testing. However, if blood sugar fasting post lunch are also included in the children who's having a frequent sickness, frequent illness, or requiring medical attention very regularly, then possibility is that this type 2 diabetes can be detected earlier in absence of classical symptoms of diabetes. How to differentiate whether a child is having type 1 diabetes or type 2? There are some special investigations done which can rule out whether the child is having type 1 diabetes or type 2. These investigations are C-peptide, serum insulin testing, anti-insulin antibody test, and islet cell antibody test. These are the tests which are very common in type 1 diabetes, and sometimes you can extract history of childhood measles, mumps, rubella, or some weird infection in early childhood. So if a child's sonography or CT scan of the abdomen is normal and one of these parameters, that is C-peptide or serum insulin levels, are abnormal, then the possibility of type 1 diabetes is there and it can be confirmed by doing additional testing. But if a sonography or a CT scan of the abdomen is normal and blood sugar fasting PP are abnormal and C-peptide levels are normal, then in that situation we usually label the child to have a type 2 diabetes, and this type 2 diabetes can be treated with lifestyle modification and if required oral anti-diabetic drugs, and sometimes even insulin can be given for a short period. However, if a diagnosis is type 1 diabetes, then probably these children require insulin lifelong, at least as on today. So today I have discussed presentation of type 1 diabetes and type 2 diabetes in early childhood, how to investigate and diagnose, and what are the different modalities of treatment. If you wish to know further, you can log on Lybrate.com or you can contact me through Lybrate.com.